some light pants for biking.
Last-minute purchases under the wire. Malls here just reopened last month, but even some shoppers agree.
They should not have opened, they should have waited.
Tonight, they close again for at least 4 weeks as a new emergency province-wide stay-at-home order takes effect.
Things are extremely serious right now.
Only grocery, drugstores, and garden centers can remain open. Big boxes are limited to selling groceries, cleaning, and pharmacy products. Ontarians are expected to stay home and limit contact with each other as the daily COVID count punches repeatedly above 3,000. This is the order so many experts wanted for so long.
There should have been action 6, 7, 8 weeks ago. So the fact that it's delayed this far is, in my mind, not only is it unnecessary, but it has resulted in illness and deaths that are unnecessary.
But the province is signaling it is listening. Today, a major pivot in its vaccination strategy.
Mobile teams are being organized to administer vaccines in high-risk congregate settings.
Those teams will head into hotspots and vaccinate anyone 18 and up. They'll also hit big factories and warehouses, the source of so many outbreaks. Teachers in 2 of the province's worst-hit areas also eligible for shots next week. This teacher relieved but skeptical.
I have limited faith in our government's ability to roll out the plan until I see it.
Back at the mall, frustration with the stops and starts and the constantly changing messaging.
A lot of us are willing to abide by rules, but when the rules start to not make sense and have any logic, then that's hard to follow.
So Katie, Ontario has been through this before. What's different with this stay-at-home order?
Well, let's just look at schools. Last time round, it was the Chief Medical Officer of Health who had called for schools and hot zones to shift to online learning. This time around, province isn't doing that. They have shifted the burden of making those decisions to the public health units. And as we've already seen, 3 of them have pulled the trigger and moved kids to online learning.
And Katie, can we talk about what more we heard about the province's vaccination strategy?
Yeah, we heard some very robust promises today. The Premier talking about getting 40% of adults their first shot by the end of this 4 weeks. To do that, they're talking about pop-up clinics. Again, those mobilization groups going into the hot spots. And it's really hard to underestimate how big a game changer it is, allowing people 18 and up in those hot spots to now get the vaccine. So we'll be watching how all of this, the logistics, rolls out.
Okay, Katie, thanks very much.
You're welcome.
And Dr. Isaac Bogosh, also want to bring you into this conversation as a member of Ontario's Vaccine Distribution Task Force. Can you walk me through the rationale of giving the vaccine essentially to any adult who wants one in these particular hotspot neighborhoods versus, focusing more narrowly on essential workers, frontline workers?
Yeah, certainly essential workers are a major component. They need to be protected. But if we just focus on essential workers, while you're protecting obviously a very important piece, there's a much bigger puzzle there that needs to be addressed. And of course, there's other people and other chains of transmission in those high burden areas that are at risk, and sadly that can get impacted by this and land in hospital. So by really focusing on these high burden neighborhoods, I think we can do a lot of good at an individual level, but also at a population level as well.
While I have you here, can I also ask you about the Ontario shutdown? Because I'm struck by the fact that businesses are still operating, right? So we're told to stay at home, except for everyone who still has to go into work. So how much mileage do we get out of that?
In all fairness, we'll probably see cases go down, but they probably won't go down as much as we'd like and as fast as we'd like. Certainly in non-hotspot areas, they'll probably go down. But as you point out, there are lots of people that are still going to have to go into work because they are essential workers. And we don't really have policy to protect them at work. We're going to policy our way out of this third wave. We're not going to vaccinate our way out of this third wave. And I didn't see a ton of supports for essential workers there. So I think there will be some benefit, but not as much as we'd like.
Dr. Bogosh, thanks for your time.
My pleasure.